Charlotte Smith here with BladenOnline.com. Thanks for joining me. Dr. Terri Duncan, Bladen County Health and Human Services Director, gave an update to the Bladen County Board of Commissioners during their electronic meeting held on April the 6th.
Good evening.
Good evening, Dr. Duncan.
We certainly have a pandemic going on that nobody in this room, nobody in this nation, nobody in this world ever thought that would be what we are facing today. We have been blessed in Bladen County in that we have only one positive case. We have tested multiple people and are continuing to test according to the guidelines for the CDC and the North Carolina Department of Health and Human Services. Those guidelines do change, and we are expecting them to change in the future based on where we are in the life of the virus. The to-date count is 40,000 tests in North Carolina, with 2,870 being positive, 33 deaths, and we certainly have our thoughts and prayers are with all of those. Some families have lost loved ones. There are 270 in the hospital. The Surgeon General yesterday on the news stated that this coming week nationally would be one of the worst weeks. Again, living in Bladen County is to our advantage right now because we have a more sparse population and we're not used to riding in public transportation, and our lifestyles in general are not as congregated. Now, in the event that it was to continue and that we were to have more sick and more hospitalized in a rural area, then it becomes a disadvantage. But as of right now, we're very blessed to live in a rural area. The Department of Health and Human Services echoed what the Surgeon General said yesterday, and that's stay home. What we do know in all of this is that the one thing that will help prevent the further spread is social distancing, and even now moving the term to physical distancing, because socialization we need, and we've learned to do that a little bit differently, but it's that physical distancing, that 6 feet apart. You know that the recommendation came yesterday from the CDC that if you were out in public and you were anticipated to be less than 6 feet, that you wear a face covering. That's not a mask, that's a face covering. As Mr. Dallas mentioned earlier, face masks are to be reserved for healthcare and EMS, those people that really are going to be around those folks that have symptoms, that have progressed and need medical care. So we know that based on what Secretary Cohen said today, and we know that if we stop, people want to know, well, when can we stop? Well, if we back off of social distancing, they say by middle to late May, we have about 750,000 people infected in North Carolina. And if we continue, then we won't have near that many. So I'm just asking you to heed what everybody has told us. Stay home to save lives. Before you go out, we really should ask ourselves, is this essential? And is it worth the risk? Is it worth the risk not only to myself, but is it worth the risk to who I am coming in contact with and who I am coming back home to? The guidelines for questioning has changed over the course of the virus, and everybody doesn't need a test. I want you to think 6 months ago, if you had a fever and a cough, what would we normally do? We'd stay home and treat those symptoms. Well, that's what we need to do today. If the fever, the cough worsens so that you need medical care, then you would go to your provider. And then your provider would help determine if you needed a test. Simply going to a provider does not mean that you need a test. The point of testing now has changed a little bit. We know where the virus is. We know that it's community spread. Us testing someone isn't going to change their course of treatment if we're going to test them and send them back home. It won't change the course of treatment. So one of the reasons why everybody's not being tested is because we need to save that PPE, that personal protective equipment, for those EMS, the hospital personnel that again are going to work with the more sicker patients and those that are going to require longer time. And every time we test somebody, somebody has to guard from head to toe.
Commissioner Michael Cogdell asked Dr. Duncan how many tests had been performed in Bladen County.
We know roughly 50 in Bladen County. However, providers are not required to report to us their test unless it is positive. So providers may very well be ordering the test, but we don't know it. When a provider orders the test, they are to instruct the person that they are to go home and to self-isolate. We have tests available at our local hospital and at the health department if a person meets the guidelines for testing. So right now, if we test at the health department, that's going to go to the state lab. We did get a result within 48 hours from one we just tested recently at the health department. The hospital now is testing with and going to the state lab. Originally it was somewhere 4 to 6 days, and then it ended up 4 to 10 days. But if you are sick, like I talked about earlier, if you have symptoms like fever, cough, you stay home. If you are going to see your provider or go to the emergency room, you call ahead so that they can prepare and make arrangements for you, because you might come in a different entrance or you might not come in at all. But you do need to make that call before you go.
Dr. Duncan did ask to address the commissioners on a separate matter before completing her report.
This is National Public Health Week, and I just want to say that everybody in Bladen County has been a public health practitioner in the last couple of weeks, and I am so proud to be living in a community in a county that has taken this so seriously, and I just want to say thank you.
Visit bladenonline.com for more information.